Thank you, Mr. Chairman, and I want to associate myself with the remarks of Mr. Neal from Massachusetts, and I feel badly for a lot of our colleagues and friends on this committee who work in good faith and have strived their best to come up with what everybody thought was a compromise and working together on a bipartisan basis. Apparently that view was not shared by Mr. McCarthy and the 25 who have other purposes, and especially and most glaringly, as Mr. Doggett articulated, the private equity issue here is just verboten. To be in a situation where private equity, and Mr. Chairman, I'd like to submit for the record 3 major studies that have gone on with regard to the impact of private equity purchases of health care on patients, which is our final goal.
Without objection.
Thank you, Mr. Chairman. The reason that we do that is, again, to point out, as Mr. Neal did, how close we were to having a bipartisan deal that would actually have a direct impact. There undoubtedly are some good things in this bill, I think, that people would like to acknowledge. But when it becomes ruined and tainted by private equity being able to come in, now the only reason they're purchasing these healthcare organizations is to make a profit. There's nothing wrong with making a profit. But what's wrong, and I think everybody on the committee knows this, is when that profit comes at the expense of patients. Undoubtedly, everyone on this committee is striving to make sure that Americans have the best health care system that's affordable. But it's how do you conceive that that is even possible when we look the other way at what private equity companies are doing and how they're destroying a system. So all the goodwill that's been built up, all the hard work and effort is thrown overboard so that private equity firms can come in, buy up these healthcare organizations, and then hurt the very patients that we're trying to help in this process. That is my concern, Mr. Chairman, and especially with the limited amount of time we have left before we go on break. And again, I feel badly because of the people on both sides who were working in earnest. But this is a bridge too far. And to turn this over and acknowledge that, no, what we're going to do here is allow private equity firms to continue to gouge the public is just unconscionable. And with that, I yield back.